Hi, my name is Julie Landon. I'm a nurse practitioner here at the clinic. I was looking at the results from your 12-month mammogram, and it looks like they were great. So congratulations on being breast cancer free for 1 year. I did, however, want to go over your DEXA scan results, which are the bone density scan that you did. For these results, you'll get what's called a T-score. And the T-score represents basically how much higher or lower your bone density is when compared to like a 30-year-old. So at 30 is when our bones are the most dense and they're the strongest. So the lower your score, the weaker your bones are. A T-score of -1 to 0 is a normal bone density, and your score came back as a -2. So because of that score, that puts you kind of at risk or shows signs that you are developing what's called osteopenia. This means the inside of your bones are becoming brittle from a loss of calcium. So typically there's not really any signs or symptoms of this unless it continues to develop into what we call osteoporosis. So let's discuss what osteoporosis is and why you've kind of been at a higher risk for it. So osteoporosis is a condition where your bones become less dense and you're more likely to have fractures. Women who have had breast cancer treatment are usually at an increased risk for osteoporosis and fracture. Because of your chemotherapy treatment and surgery, breast cancer survivors like yourself have experienced a loss in ovarian function, and consequently that causes a drop in estrogen, and a drop in estrogen leads to an increase in bone reabsorption. So estrogen is essential to bone health because it promotes the activity of osteoblasts, and osteoblasts are the cells that help to make new bone. So when estrogen levels drop, for example, during menopause or because of surgery or medications, a person's bone density decreases. So another risk factor that you have is you're taking tamoxifen. So tamoxifen is what you're taking to block the effects of estrogen on cancer cells. But it does put you at a slightly higher risk of osteoporosis because you're a premenopausal woman. So to review, you don't have osteoporosis yet. You have what's called osteopenia and some risk factors because of your breast cancer and your treatment and the medications you're on. It increases your risk for that to further develop into osteoporosis. So let's talk about what we can do to really help hopefully curtail that osteopenia and make your bone, keep your bone density as the best that it can be. So some essential things that we need to talk about are nutrition. As far as bone health is concerned, a well-balanced diet is super important. So we really want you to have a diet high in vitamin D and calcium. So good sources of calcium are going to be those low-fat dairy products, dark green leafy vegetables, and calcium-fortified foods. If you don't feel like you're getting enough calcium in your diet, we would really encourage supplementation because we want you to have about 1,000 milligrams of calcium in your diet a day. Also, vitamin D is super important for calcium absorption and bone health. So food sources with vitamin D are like egg yolks, liver, saltwater fish. Most people, to be honest, don't get enough vitamin D in their diet. So we would encourage supplementation. We really want you to get about 600 to 800 international units of vitamin D in your diet a day, and that will really help with that calcium absorption. Also, exercise is very important. Like muscle, bone is a living tissue that responds to exercise and becomes stronger. So the best activities for your bones are going to be weight-bearing and resistance exercises. So weight-bearing exercises force you to work against gravity. And so they include like walking, climbing stairs, dancing, and then resistance exercises are going to be like lifting weights. And both of these are going to help strengthen your bones. We also want to ensure that you're maintaining a healthy lifestyle, so no smoking and keeping alcohol consumption to a minimum because both can have negative effects on bone health. And then lastly, we just want to follow up with you to make sure that your bone density is going to stay the same or even improve. So we want you to take a bone density test yearly. So we'll try to order that DEXA scan yearly and then have you follow up in the clinic so that we can monitor those results and see if you're maintaining and how you're doing. So do you have any questions about osteoporosis?